reporting from the Chinatown Health Clinic Foundation's annual dinner. And joining us now is the man of the hour, the individual being honored tonight, renowned virologist and AIDS researcher, Dr. David Ho, the 1996 Time Magazine's Man of the Year. First of all, Dr. Ho, it's such an honor and such a pleasure to have you here. I'd love to hear from you. How does it feel on your end being honored by the foundation this year, even though you have such a long history with this organization?
Well, first of all, thank you very much. Of course, I feel proud and honored and to a large extent humbled. The Chinatown Health Clinic does so much good for the community, particularly those who are underserved, the immigrant population, largely from Asia, and they do good day to day for many decades now. So to be honored by them is a great deal for me. I'm largely on the research front. We make our impact in a different way, not as frequently as daily, but periodically. So it's nice to hook up with this organization once more.
Dr. Ho, you talked about this daily impact and the daily reality for a lot of minority communities and Asian Americans, whether they're new immigrants or have been citizens and residents here for years and years, is that they don't often have access to basic health care needs. In your tenure in this position and working specifically with the Chinatown Health Clinic Foundation, how have you seen some of those gaps to access improve?
Well, I've been in New York for close to 35 years, so I witnessed much of the history of this organization evolving from health fair to a free clinic and now to a federally recognized quality healthcare center. Immigrants come seeking better life in America and they have dreams and aspirations they would like to achieve, but yet often they come with very little and they need all the help they could get, and quality health care is essential. And this provides a great need for the community, and I'm really proud to be associated with the organization.
And I'm sure they are so proud to recognize you in this fashion tonight. Once again, Dr. David Ho, the man who is being honored tonight at the Chinatown Health Clinic Foundation's annual dinner. Stay tuned, we have some more folks here. We'll catch up with them soon. Joining us now is Mr. Kaushal Challa, the CEO of the Charles B. Wang Community Health Center. Mr. Challa, I'd love to hear from you about the relationship, the symbiotic relationship that exists between Charles B. Wang and the Chinatown Health Clinic that brings these kind of organizations together and makes sure that underserved communities and populations receive access to basic health care.
Sure, you said it very well. The Charles B. Wang Community Health Center serves approximately 60,000 New Yorkers. With a focus on the underserved, we believe that that everyone is entitled to the high quality primary care. Doesn't matter your immigration history, your ability to pay, or any other barrier you might face. So that's what we do every day. We have 500 amazing staff that deliver that care every day. The Chinatown Health Clinic Foundation is a collection of supporters dating back to 1971 who helped organize the very first street fair and the very first free clinic. And they have been amazing supporters and fundraisers for our mission. So because of the foundation, our health center is able to do a lot of things that I like to call it above and beyond. We provide extra services for our patients, many of whom can't pay, many who might be uninsured. But they get the same high quality primary care that everyone else can get. So we have a lot of staff who work with them before their healthcare visits, after their visits, make sure they're staying on track with their treatment plan, and it leads to really good health outcomes. So we're very grateful for the foundation.
When you talk about some of these day-to-day outcomes, especially here in New York, that has such a large, diverse population across the board, but especially so in the Asian demographic, what are some lessons from the work that you oversee at Charles B. Wang, as well as once again, the relationship that exists with Chinatown Health Clinic type of organization? What lessons do you feel can be learned so cities and states across the country that have growing diverse populations and minority groups can also service their communities in this way?
Yeah, what a great question. The major lesson is that healthcare doesn't just happen in the four walls of the doctor's exam room. We do have great doctors, but that's not enough. We have a very complicated healthcare system, and to get really high quality care means you have to think about all of the barriers that a patient might face to getting great care, right? It might be that they don't have transportation. It might be that they don't have insurance. It might be that they don't speak English well enough and don't understand what's being explained to them. It might be that they don't have access to their medical record, right? There's so many barriers that get in the way, and we are proud to be very comprehensive in our approach. So we think about not just the care in the four walls, but all of the potential barriers leading up to getting that patient into the clinic and afterwards, right? Patients have to follow up on their care plan. We need to make sure that if they see specialists, that they're able to make it there, right, that we would get the results back. If they end up hospitalized, we want to know about that, and we want to check in with them soon after. So we have a very complex healthcare system, so being able to address all of those barriers is part of delivering great primary care.
Clearly, those barriers are not just being addressed, but they're being broken. The reputation and the footprint that Charles B. Wang has reaches far and wide, not just to providing healthcare access, but research and investments into higher education. Thank you so much once again, CEO, Mr. Chawal. Thank you so much for spending your time with us, and congratulations again on the work that you guys are doing.
I appreciate it. Thank you.
And of course, since we're talking about providing care at the city level for New York City's underserved Asian American populations and new immigrant communities, joining us now is Dr. Ashwin Vasan, the Commissioner of New York City's Department of Health. Dr. Vasan, no doubt this has been a challenging few years for New York City as it is, even more so for minority communities. What would you say was the glaring realization that your office noticed as we went through the COVID years about the access to healthcare that minority communities don't have?
I think COVID revealed so many weaknesses in our healthcare systems, our social safety net, and as we saw, communities of color, marginalized communities, ethnic minority communities, including the Asian American communities at times, bore the brunt of different COVID waves in access to care and getting the vaccine. It's incredibly hard to ensure that we respond with speed and with a citywide approach while also maintaining a focus on equity and cultural competency. And that means language, that means having providers and programs in the culture and language that people speak. We've learned a lot through COVID on how to do that better, and we're very, very proud of what we're building.
You're speaking here today. You have special remarks designated to commemorate the work that the Chinatown Health Clinic Foundation has done, Charles B. Wang Foundation is doing currently. What lessons do you feel that these organizations are imparting, as a test here in New York, as, practical evidence that may be applied perhaps in other cities and states nationwide?
Charles B. Wang and the Chinatown Community Health Foundation, Chinatown Clinic Foundation, is a testament to the power of community. For decades, when care was inaccessible to the Chinese community, the Chinese American community, the community said, what can we do to build up our own strength, our own power, our own culturally competent care? It just tells us once again that public health at its root is about community. Now they've built it into something that's so powerful and visible that we can't ignore it. And so it's a model certainly that can scale throughout this city, throughout the country.
Wonderful. Once again, thank you so much for the work that the Department of Health is doing right here in New York. Dr. Ashwin Wasan, Commissioner for the Department of Health, thank you again.
Thank you.